Beginning January 1st, 2014, all group health plans, i.e. fully insured and self-funded, as well as grandfathered and non-grandfathered plans, will be precluded from imposing any pre-existing condition exclusions. In short, the plan can no longer deny anyone's benefits due to a pre-existing condition limitation. Beginning January 1, 2014, all group health plans, i.e. fully insured and self-funded, as well as grandfathered and non-grandfathered plans, will be precluded from imposing more than a 90-day waiting period. Since the waiting period could be no longer than 90 days, it would not, for example, be permissible for the plan to say the person enters the plan on the first day of the month following 90 days of employment, since this could be longer than the 90-day waiting period. Beginning January 1, 2014, all non-grandfathered health plans are limited to a maximum out-of-pocket and deductibles that can be assessed under the plan. The maximum annual deductible for single coverage will be $2,000, and the maximum annual deductible for family coverage will be $4,000. These amounts are indexed. The maximum out-of-pocket amount will be limited to the then current high deductible health plan or HDHP limits. The maximum out-of-pocket consists of deductibles, co-insurance, co-payments, etc. Premiums and balance billing from out-of-network providers do not count towards the maximum out-of-pocket for these purposes. Auto-enrollment. Large employers, i.e. those with at least 200 employees, will have to automatically enroll new hires into the group health plan. The employee will have the ability to opt out of the group health plan. The government has said that these rules will not become effective before 2015. Health coverage reporting. Insurance companies and all employers sponsoring self-funded health plans will have to provide coverage information to the IRS and the covered individuals. Additionally, large employers will have to notify the IRS if they are offering minimum essential coverage to the employees and their dependents. The large employer also must provide a notice to all full-time employees. All of these reporting requirements are effective January 1, 2014 and must be submitted and distributed for the first time in 2015. Reinsurance Program. A transitional reinsurance program will be established January 1, 2014 and will end on December 31, 2016 to help stabilize premiums in the individual market. This temporary reinsurance program will be financed by all health insurance carriers and self-funded health plans. In the case of a self-funded health plan, the TPA, on behalf of the self-funded plan, will remit the money to the program. The rules have not yet been issued with respect to how the assessment will be collected or how much each plan will have to pay, but the government anticipates the total assessment for the 3 years to be approximately $25 billion. In 2018, a 40% non-deductible excise tax will be applied to health plan coverage. The 40% excise tax is applied to coverage in excess of $10,200 for single coverage and $27,500 for family coverage. These amounts are indexed. Like everything else with healthcare reform, the rules to calculate the value of the coverage are complicated. In the case of a fully insured plan, the carrier will pay the tax. However, it is safe to assume that the carrier will simply pass that cost on to the employer in the form of higher premiums. If the plan is self-funded, the plan administrator, i.e. the employer, pays the excise tax.